During medical school, I explored many different specialties through my volunteer work. And one of the organizations that I volunteered with was called the Mobile Eye Clinic, and they provided care to underserved patients in rural areas without access to a medical facility or doctors. One of the patients that I met while volunteering with the Mobile Eye Clinic was this man in his late 70s. When I first met him, he was just kind of disheveled, disorganized, and our initial evaluation led us to find that he had cataracts, so we recommended bilateral cataract surgery for him. And I ended up seeing him a couple weeks after his surgery, and it was like I was looking at a totally different person. He was beaming, he was really well dressed and put together. He was proudly telling me how he was reading to his grandkids for the first time in years and cooking dinner for his wife and driving around for the first time in many years. So the impact cataract surgery had on his life was just really incredible, how much it empowered him and brought him to be the best version of himself. So that really inspired me to go into ophthalmology, and that continues to fuel my passion to treat our patients and be an ophthalmologist.